1.
Hello, everybody. My name is Dennis Compton, and I'll be the moderator for your session today titled Occupational Exposures in the Fire and Emergency Services. To get started, I'd like to introduce our panel. Pat Morrison is the Assistant General President for Health, Safety, and Medicine with the International Association of Firefighters. Among other things, Pat develops and disseminates knowledge within the fire service so firefighters and emergency responders can recognize and control the safety and health hazards and the occupational medical issues associated with the firefighting profession. Chief John Oates is the chief of the East Hartford Fire Department in Connecticut, also president of the Connecticut Fire Chiefs Association, Career Fire Chiefs, and a longtime contributor to the NFF's Everyone Goes Home program. He is also a member of the First Responder Center for Excellence in Behavioral Health Advisory Committee. Chief Oates was part of a multidisciplinary team that crafted and saw passage of groundbreaking firefighter behavioral health legislation in Connecticut. And finally, Dr. Lori Moore-Merrell is the president and CEO of the International Public Safety Data Institute. She's an expert in executive leadership, emergency response system evaluation, public safety resource deployment, community risk assessment, data collection and analysis, strategic planning, and many other areas of management expertise. In addition, Lori also lectures about generational differences in the workplace. So Pat Morrison is going to cover presumptive laws. Chief Oates is going to talk about evidence of exposures, and Dr. Moore-Merrell is going to talk about exposure tracking. And to get us started, I'm going to turn this over to Pat.
Thanks, Danny. I appreciate that. I want to welcome everybody to what I think is one of the most important things that we could be talking about at this virtual symposium, and that's really the exposures and what does that mean for the fire service, and what kind of protection does that mean for the fire service. And just to begin with, presumptive laws, what do they actually mean, and what do they do? And I kind of want to walk through some of the language on that, because the language is very, very important. But then I want to back it up with what is actually happening out there, what's actually working in the field, what's going on in the US and Canada that we record, because we cover both of those at the IFF. A lot of people don't understand, and it can be complicated, and then it can be real simple. But presumptive, the burden of proof, if you have that presumptive coverage, and you've applied that to you, the burden of proof is on the employer to rebut or disapprove, those illnesses or disease, and especially, right now what we have is such a high rate of cancer, and cancer presumption is so important. But having that coverage, that means that you are protected. The burden of proof is on the employer, which we feel at the IFF, that's exactly where it should be, and that's why we fight very hard politically to get these laws on the book. Benefit eligibility, it sounds like, all of a sudden you have a benefit and you're eligible for it. Well, what that actually means, if you don't have presumption, the eligibility is all on you. You are the employee. You have to make sure that you prove the burden of proof. Everything that you have to document needs to be documented if you do not have the presumptive coverage. And we're going to be talking, other presenters here, about how important that documentation is and how we document. But it's not simple. This is not guaranteed. Having presumptive coverage isn't a guarantee, but anybody going into the court of law would want that on their side, because the other side has to prove that whatever your illness, whatever your disease, whatever happened to you is based on what your activity is, and you better make sure that you have all that coverage. I always bring this up. I want to talk about this a little bit. This was the last time our fallen firefighter memorial. This is in Colorado Springs. And this is, just to give you the numbers, we put about 250 names on the walls. That's what we do. And we have a beautiful memorial out there. And it's the most sacred thing that we have at the IFF. And we really believe in that. In 2019, out of those 250 names that we put on that wall, 79% died of occupational cancer, 79%. And these are cancers related to the fire service. That number is, and we've talked about this in the fire service, We have different alliances. We have other organizations that have gotten together, and this is probably one of our #1 health and safety issues that we have to address. But I just wanted to say that because people don't understand that. Okay, so 79% of that percent of firefighters, if they have presumption, then they have some coverage, and they probably are getting some coverage from their state and their local municipalities. If they don't, we're putting a name on the wall. That doesn't mean that they come from a state that has all of that protection, and they might not be getting that. And we really feel that occupational cancer, we know what that occupational cancer is, and we feel that those cancers associated with that are the ones that should be covered. So here's just a map. I just want to give you, sort of on the cancer side of things. We're doing a pretty good job out there as far as Canada is doing an excellent job. They in some ways, their political system and what they've been able to put on the books and their coverage that they've been able to put on the books is really amazing. It's quite a testament to what they do. And you see in the US, you see that benefit eligibility. In any one of those states out there, the benefit eligibility actually means that firefighter has to fight or somebody has to represent that firefighter, or that firefighter is just not going to get the benefit. It's going to be a hurdle that they're not going to be able to cross. And then you see that we have no presumption or benefit eligibility. Those are areas that we have to do a better job politically, and we have to get, and that's what we do at the IFF. We really try to look at every one of these states, knowing that there are some differences, but we try to make sure that we give all of those members in these states at least the information that they need, the legal language that they need, and the political leverage that they should be putting in. The IFF, we have a center of excellence. The reason I put up this slide is that we've seen almost close to 1,800 firefighters that have come to our center of excellence. It's a facility. It's in Maryland, close by. We set it up there for treatment. Not only for substance use disorders, but we set it up too for mental health. And before we even started to put, our protection, our efforts to make sure that we had the center, we wanted to make sure that we were addressing the mental health issues because nobody else was addressing those. And we had suicides that were coming in from so many different places, and we really felt that we needed to address that. So, to date, it's about 722 that when you come to that center, you're either there for the substance use disorder or mental health or both. There's a lot of co-occurrences between two of those. And you can see that PTSD, firefighters come into our center, about 40% of them are PTSD related. The 60% are other mental health disorders that we have that they're faced with, and depression, and a long list of those. But it just gives you an example of that. We're seeing about, close to 45% of the firefighters coming there have a very, very distinct mental health disorder that we have to address. And we do address it there. We have some of the modalities from the experience that we've had over the last 4 years. We're really narrowing in and saving lives. I mean, it's amazing when I go out there, firefighters telling us that we have saved their lives. But it's very difficult to get people there. And because if insurance doesn't cover it, if we can't get somebody in there, and if it's not covered under a presumptive, this is something that we want to take a look at, for the fire service, that, mental health should be covered under a presumptive coverages. And I'll go over a couple of areas there. The clinical areas that we see, with the PTSD, but the major depressant, the, bipolar, substance use, societal, anxiety disorder, personality, and other complications. We have seen just about everything that you could possibly see. And we've really been able to take that information and that data and really treat firefighters that come there where they're at that moment and what they are suffering with. Just to give you an example, here's another map. This gives you the PTSD sort of presumptive. And look at Canada again. I mean, Canada has done an amazing job of protection on mental health disorders, and just incredible job. So far, we have not caught up with them. The US is lagging far behind. Again, you can see those green states that have that presumptive coverage. You see the yellow that have that benefit eligibility. I talked to you earlier those in California, New Mexico, you can see it on the map there. They're going to have an easier job getting protection and getting it covered. And I really feel that that's an area that we have to improve upon. And then you can see where there's no coverage at all. There's just nothing. There's, if you have something, you're not even considered as a workers comp case. They don't even want to see you. They don't even want to even diagnose it. It doesn't exist, because that's not what happens. But that's not what we're seeing in that slide earlier. We're seeing firefighters that are adversely affected by their career, what they've seen, what they've gone through. And this is an area that we know at the IFF that we have to improve upon. COVID-19, I wanted to talk a little bit about this. Here's the, and this was an issue that we had early on, and when COVID-19 hit the states, and you can see where language has been introduced. Those are the brown languages. The green, we've been able to get COVID-19 under the existing law, the existing infectious disease laws in there. And then in some cases, we've been able to get executive orders. Those are the purple states, going through the executive orders to the governor. The problem with executive orders is that that can be changed. That's like any executive order that you see at any level of the government. Somebody can come in and say, "Hey, I have an executive order that's going to overrule that other executive order." What's so important about this? Right now, currently, we have 173 firefighters and EMS only that have died from COVID-19. Again, I'll say that 173 of those members, and this is something that is related to their job, what they were exposed to, and how they were exposed to it. But I wanted to give you that, and then we have even Canada. We only have Ontario that has any kind of directive that covers those people with COVID-19. But again, when I see this map in here and I see the numbers, and those numbers are going to continue to rise as we go on. This is why, again, everybody thinks it's cancer presumption. We can get that, or it's infectious disease. We can get that. They forget that COVID-19 was a struggle for us to actually get this on the map in so many states to have some protection. The Public Safety Officers Benefit Program. That is a program that I think everybody here is familiar with, and that's something that we had to fight. We had to fight very, very hard to get COVID-19. You have 173 firefighters that I mentioned, and then how do you get them covered under the current PSAB? And we were able to do that legislatively through a bill. We were able to get to Congress. We were able to get the House and the Senate to pass it, where a firefighter now that can document that they had an exposure, a documented exposure, and that's why it's so important that some of our other presenters will actually cover that. But you can actually basically the coverage is, and that's the benefit of $365,000 to the family. That's the PSAB current benefit, and that includes educational benefits on this. And they have that, and that's why it's so important for us to make sure that we know what the PSAB benefit is. We know that benefit is there, and we were able to fight that and put that under. We actually thought when we were doing this benefit that we would be covered automatically under the SARS bill, and that was not the case. We had to introduce language that COVID-19 would be covered underneath this. Again, we have the protection on that, and I've seen that. Listen, I'm gonna close. I mean, that's the end of my formal presentation, and it's the end of the slides in there too that I have. But just the coverage that we're going to need for infectious disease, PTSD. We have to finish on the cancers. How important that is, not only for us but for the fire service, that we're making sure that we are protecting our members, that we have our members' coverage, that the coverage is there, and this is not easy. At the IFF. We put full court press on different states. When a local calls us up and we have a bill that we're running through the House or the Senate of that state, we're with them every step of the way. And sometimes it's not easy, but for us to get that language into a bill form and get that passed, we're making sure that we have all the necessary. They have all the necessary information. So we have other speakers that are going to cover this in a little bit more detail. the exposures that, you know, Dr. Moore is going to talk about the exposures, which is extremely important for us. And firefighters, you know, think that it's not going to happen to me until it happens to them. And then you're going back and you're looking at records that just don't exist. They don't understand that. And I think it's part of leadership from both the fire service, you know, fire departments and the labor side in there to make sure that we are documenting this and we have this down to a point. So thank you for allowing me to kind of go through some of the information that I have there in the slides. And I'm available if anybody has any questions for me. You can contact me at the IFF. Now I'd like to introduce our next speaker, John Oates, who's the chief of the East Hartford Fire Department. John is going to continue with the evidence of exposures. And I thank you again for allowing me to present. Thank you.
Thank you, Pat. And if you unshare, there we go. So as Pat mentioned, I'm going to talk a little bit about evidence of exposures and what that means and what evidence is necessary, because simply having a piece of presumptive legislation is often not enough to carry a claim through fruition. The presumptive law creates a link between a particular occupation, in our case firefighting, with a disease condition that's been shown to be a hazard associated with that occupation. And the research is very clear that there's a nexus between firefighting and occupationally related cancers. There's been more research done on fire service injury, illness, health, wellness, and certainly fire service cancers. There's been more done in the past 10 years than there was done in the previous 100. And as we look at those research pieces to help support both the need for presumptive legislation and to help explain how we can prevent contracting an occupational related cancer. But once that connection's made as a result of the linkage, if an individual, one of your firefighters, one of my firefighters, that's covered by the presumption, contracts a disease, in this case cancer, that's specified in the presumptive law, then that disease or condition is presumed to have come from that occupation, meaning there's an attachment. My work as a firefighter is directly and causally attached to the cancer that I got. But it's a lot more difficult than that. You have to break down what is existing in the legislation. Pat did a great job of illustrating the breadth of legislation and the types of legislation currently in the United States and Canada. But each one of those, whether you have presumptive or rebuttable or whatever the provisions are in your territory, in your state, you have to look at what the requirements of the law are. What exactly is it? Specific cancers? Is it specific timeframes? Are there requirements on the front end that you had to have an entry-level physical or an annual medical physical, or what the attributes are that will lead you down the path to coverage? And be very, very intentional about looking at that information. So the concept with presumptive cancer legislation is that the burden of proof is removed from linking the work of fire service to the disease. That in theory is the concept that legislation covers. There's no level of proof, balance of probabilities for those initially. However, the firefighter still must meet the requirements of the law. You have to read and understand all that the law requires. If you haven't, and I don't care if you're from FDNY, Los Angeles, Chicago, or Resume Speed, Iowa, wherever you live and work, or whatever jurisdiction has legislative authority, you need to go look at that bill and that law and that regulation and understand exactly what it means. And now they get really complicated. They're very complex. They're often full of either medical jargon or legalese. So it's important to reach out to your volunteer fire association, state association, IFF, or somebody that has experience in that law to be able to understand each component that is featured in that piece of legislation, to ensure once you walk, if you, God forbid, you or a family member has to walk down that path and understand, am I covered? Am I not covered? Is my cancer one of the ones? Is my work duties fit? You'll have a better understanding on the front end, because I think we've all seen too many really, really tragic and unfortunate cases where members of our fire service, members of the United States Fire Service and Canada and our friends and partners that thought they were covered and were told they were covered. And then once they were diagnosed and treated that specific cancer isn't covered, or they missed an important yet simple checkbox on the front end that they could have had an easier time moving forward to ensure that they were covered. Even though a state may have a firefighter cancer presumptive law, it's not a guarantee an approved claim. You can't just go like, I've got coverage, so no matter what I do, I'm going to be covered. The legal presumption always allows for an employer to rebut the claim, even though the legislation may say otherwise. Generally speaking, the employer allows rebuttal. Insurance companies that provide workers' compensation or insurance companies for pension funds often have rebutted cancer claims. Pension physicians, board trustees, people that control pension funds, disability pensions, have rebutted cancer claims, and then it puts it back in our court as the firefighter or the fire chief or the department, or perhaps even sadly enough the family member to push back and go, now I have to develop this evidence and paint a picture and explain what my family member or what I did as a firefighter that led me down the path to contracting the occupational related cancer. And the thing I hear all the time is, but they said I was covered. You know, the X state or X city said that I was covered. And the answer is most likely, or yes, but. Firefighters often have to prove 3 items in a workers' compensation case. For us, when we get injured, you twist an ankle at a fire, or strains and sprains, or the things that, orthopedic injuries that we normally get in a working fire or some significant incident, you still have to survive the 3 tests. Did it occur while I was working? The injury or illness occurred. Did it occur while I was working? And is there a link between the two? That what I was doing at work was causally related to the injury. And that's really simple I don't say it's simple. It's simpler for a broken bone or something that was witnessed. When you think about the things that cause or drive occupation related cancers, or even some of the other things that Pat talked about for behavioral health or for COVID, you can't track back to the exact moment that the COVID germ passed through your nares and infected you. You can't rarely can you find the exact moment where you say, well, that's the minute that I contracted cancer, because it's usually over a long period of time throughout your entire career. So there's a lot of things that make it difficult. And it's just, well, what does the level of proof mean? What do I have to do? And there's 2 different standards often. There's a preponderance of evidence and clear and convincing. Preponderance of evidence is the burden of proof is met when the party with the burden, which is us, convinces the finder of fact, which is either some sort of tribunal or court or legislative body, that there's a greater than 50% chance that the claim is correct. So that's for the things that we're talking about: occupationally related disease, cancers, behavioral health. That's usually a standard that we can meet with a little bit of research and a little bit of work, is we can meet preponderance of evidence. For those that include the language that says clear and convincing, that is a higher threshold. It's a little bit more difficult. It means the evidence is highly and substantially more likely to be true than untrue. And you have to convince the finder of fact that the contention is highly probable. That connection that we're looking at, that nexus between firefighting and cancer, is absolute. If a claim is rebutted, the firefighter's counter arguments may become more difficult. When somebody says, no, time out, we're not gonna accept your cancer claim. Now we're walking down this pathways. Which standard do I have to meet? Do I have to meet preponderance of evidence, or do I have to meet clear and convincing? Again, why it's important to look at the legislation to understand fully what the requirements are. And the same thing, and here's a simple case study that I'm far too familiar with. And you can do everything, understand you can do absolutely everything correct and still have the claim denied. In a case, a career firefighter with a diagnosis of lung cancer, 25 years of service in the same community, had an entry-level physical on the day that he was hired. Subsequently to that, he had an NFPA 1582 compliant incumbent physical annually and passed, cleared, approved by the health doctor to work as an interstructural firefighter. Had a clear chest x-ray several years prior to diagnosis, so showed no evidence of cancer. Evidence of exposure during years of service through NFIRS 902 reports and other documentation. And yet that claim is still denied and currently working through the system. So even with all that evidence in a state that uses the preponderance of, not clear and convincing, but the preponderance of, the claim was denied, and puts it back on the family and the department and the local to fight through that. And if you think about it, in a case like this, What did your department's records management system look like 25 years ago? They might have had a logbook on the desk in the firehouse. They may have been doing NFIRS or 902 reports by hand on paper. And if you had to search back, and their rosters weren't electronic, there was no N4s, there was no telestaff, there was no firehouse software or any of these other records management platforms that we're comfortable using today. It was paper. So now you have to, if you need to provide that linkage, you have to dig through 25 years worth of paper. And for the career fire service, working 42, 48, 56-hour work weeks and go back on the schedule and account for how many shifts the member got transferred to and promotions and who did he work with and where did he work and what calls did he go to and know he was off that day, he was working a swap here. It's an incredibly daunting task to be able to cover all those things. But without that evidence of exposure, whatever level of evidence that your legislation requires, you have a tougher road to overcome because you're starting from zero. So it becomes very, very important to look at what the exposure requirements are in each state. Most states with cancer presumptive laws or cancer benefits will have an exposure requirement. There's a few that have none, but that still doesn't mean they can't rebut the claim. But an exposure still must be shown in that to meet the three-pronged test that we previously admitted. Therefore, every state in the US, every province of Canada, every firefighter working in your fire station, whether, again, working, I don't care if you're a career volunteer combination, what sort of municipality you serve in, what sort of work that you do in the fire service, you need to have a mechanism to track your exposures. So with that, I will pass it to Dr. Moore because she will have the ability to talk a little bit more about what and how to track that exposures to ensure that as we go through our career, we track these, we pay attention to them, and we have the knowledge. So take the time, go look at your state or your provincial law, understand what it says, understand what the coverages are, and start tracking your exposures. And with that, Dr. Moore, I will unshare and let you pick up from there.
Very good. Thank you, Chief Oates. So I will share now my screen and be able to share with you some additional slides in this discussion. So thanks to Pat and John for setting it up. And so now we're going to move to the third phase of this presentation and look at that exposure tracking requirement. So just as John and Pat both alluded to, it is important that you be able to track these exposures. For so many years, and even when I was at the IFF, we had so many cases where firefighters either had just been diagnosed with cancer, they had been diagnosed and already passed away before they got their workers' comp claims processed because of these issues, because they did not have evidence of exposure. And so these presumptive laws can be challenging. And so I've just, on this particular slide is just a summary basically of what both Pat and John said, is that these presumptive laws are in place. We fought very hard to get them, both throughout the United States and Canada. And it matters, but most of these laws do have requirements for exposure tracker in them that we failed, honestly, as they were passed, to make sure everybody understood that these are not carte blanche and they can be challenged at times. And they literally, as John said, can be challenged by anybody. Even into retirement, your pension boards can challenge these laws or these claims should you have a cancer diagnosis into retirement. And so these are the kinds of things that we think it's very important that you understand and are prepared to handle. So what are some of those requirements? And this is important because these are the specifics in the laws. There are a few laws that are very similar and will have some of the same list, but it's important for you to note what is the exposure to. We can't just say exposure in general because your laws are going to be different. So just evidence that you ever went on a call is one thing, but being able to say, yes, I was exposed, and these are what you're seeing on the screen now is exactly the words that are taken from 3 different laws: heavy smoke, fumes, carcinogens, right? So you see the words that are there actually involved in firefighting. All of these things are the words that are actually written into some of the laws. And there is one source that is often quoted in your law that you may not be completely familiar with, and that's the International Agency on Research for Research on Cancer, or we call it IARC in the research arena. Well, IARC actually establishes those carcinogens in the list of what is on the list of carcinogens. And so often you'll see a law that says something like this: exposed to known carcinogen as defined by IARC. You may not have ever even realized that was in your law. And so we have many laws that will have literally, if you weren't exposed to something or show exposure to something that's on IARC's list for a known carcinogen, then it becomes an issue. So understanding the language in your own state law, or your own provincial law, if we might have others watching this from outside the US. So it became very important for us as a group of researchers, now at the IPSDI, but formerly leading from within the IFF, and of course partnered with the IFC, the Metro Chiefs, and many others to develop an exposure tracker. And this exposure tracker has been developed over time. We have been funded by the AFG FEMA Assistance to Firefighters grants, and we're very grateful for that funding, because this is something that is directly related to you keeping a personal database of your exposures throughout your career. Now, we hope you never need it, but should you need it for cancer, for PTSD diagnosis, because that's something else Pat mentioned, one of the details that a lot of people don't understand is that for a PTSD diagnosis, it is often going to take you pointing exactly to the event that caused it. And that is in the diagnosis codes. So we have a lot of work to do, but having a personal database of your exposures, both your physical exposures and your traumatic events, become very important. And being able to keep that with you into retirement, so you have it available, because unfortunately we see these events occurring post-retirement. We have the PTSD issues. We have the cancer that shows up because of the longitudinal development of cancer, right? You don't even realize you have it until 2 years off the job. And so it is important that you have this type of evidence, because it is rare that there's a department that will keep in perpetuity your exposure records after you retire. So the app is available. It was developed based on these presumptive laws. And so for you to be able to have not only your exposure, but it has in this app all of those elements that are required for you to have evidence of exposure from the job. It does work on iOS and Android, and you can see it is available in both of the app stores to you. We do issue for those departments that are on the National Fire Operations Reporting System module, the analytics module. If you are connected to our analytics module, then we do provide an incident access code for you to enter straight into this application. In other words, we reduce your data entry as an individual. Now, any firefighter can download it and use the app. It is free. Like I said, we built it with grant funding. It is free. Download it, use it today. But if your department is not connected to our Enforce Analytics, then you will have to enter incident codes. You will have to enter an address of each incident prior to logging your exposure, because that is validation, and it will be required should you have to produce evidence. That validation that that call was real and you attended, right? So we do provide better, more streamlined automatic data entry for our departments who are on our analytics system straight into the exposure tracker. So it does minimize your overall data entry on your exposures as an individual. So why track your exposures? Well, I'm going to reiterate some of the things that you already know that we talk about all the time. Firefighters are in contaminated environments. And this is important. I want you to hear this. Just because you document an exposure doesn't mean something went wrong. And we often think that. It doesn't have to be a breach in your PPE. It doesn't have to be, that your mask came off, or you had a tear in your turnout gear. You are exposed, your gear is exposed every time you make an event, right? An incident. And so it doesn't mean something went wrong. You should be documenting exposures. You're exposed often to diesel exhaust on every single call. So these are exposures that you need to document, and having those things and a mechanism by which to do that is what we try to provide to you through the Enforce mobile app and web application. So this dermal exposure, the inhalation exposures, all of these things matter. In fact, if we talk to a lot of the cancer researchers, they will tell you, if you're on scene and you smell the smoke, you've already been exposed. And so it is important that you understand that it's not just a breach in PPE. It's not that, you know, somebody did something wrong, but you are exposed by virtue of the fact that you're on that incident, and we need to document it. So behavioral health, same thing. We have, as Pat noted, 1 in 5 firefighters, you know, suffer from post-traumatic stress, and we're seeing it even more play out in that 40-60 split at the behavioral health center. So we really want to document, and maybe, and I've talked often with some of the behavioral health folks at the center, and it is important that maybe sometimes it's just getting these out of your head, having somewhere to write down what you saw or what you experienced, to be able to get it, process it, get it out of your head. And so the app does that as well. And it keeps it in a secure, encrypted environment. And it's important to note too, that the department, no one else can see your own individual data. It is secure, it's encrypted to you. You do have an option to share your data if you wish in an anonymized situation with some of the cancer research that's ongoing, with COVID-19 tracking. That is part of the app now. We've put that in the EMS module in the app so that we can document those COVID exposures, because as Pat talked about, there are presumptions going on, but I guarantee you they are going to require that you show COVID exposure to be able to claim those presumptions. So those laws, our national law that was passed immediately for COVID, first responder COVID presumption, absolutely had a requirement that you had to show you were exposed to a COVID patient. So we immediately updated the app to include that. So it's important that you know that all of those things are available to you in the app. These are some of the materials. If you want to promote this in your department, you let us know and we'll get you these materials. Again, the app is free for download. Anyone can download and begin your career diary even now. So please do so. Go to the app stores, look at what is available to you, reach out to us and say, can you send me some promotional materials? You will note on the posters, everything that we have, our partners are always involved. So all the way across all organizations to promote this exposure tracking capability is so, so very important. And so with that, I'll remind you again that you can download the app. We do have, the mobile app obviously is the easiest to use, but we do have also a web application. You'd be surprised how many firefighters still carry flip phones, or maybe you wouldn't be surprised, but we have a lot of firefighters that still carry flip phones. So you can use this as well. It is a mobile app, but there's also a web application, so you can get to the web version as well. For those on the mobile app, you want to be able to print out your exposures if you need to file a claim. So you go into the web application and the print function is right inside. You can download and print out your whole list of exposures for your entire career or whatever time segment you need to file a workers' comp claim. With that, I will tell you that we are working with Drexel University and Dr. Jennifer Taylor to find funding to be able to add an injury tracking module to the app as well. So hopefully very soon you will be seeing not only the fire, EMS, hazmat, technical rescue, and behavioral health modules, but we'll add a 6th module that will become your injury tracking module. So truly you have a career diary of everything that has happened to you on your within your career, and it stays with you for life. So please do reach out with us, talk with us. We're happy to do a demo for your department, show you more how to use the application, download, start your career diary today. So with that, I'm going to hand that back to Chief Compton for the wrap up.
Well, thank you, Lori. And thank you to the panel. Like I told you when we began, you were in for a real treat because what a great job by all the panelists. So what we're going to do now is open this up to a question and answer period. And I'm looking forward to that because it's always nice to interact with all of you.